Someone asked in the comments how you can tell the difference between chest pain coming from your heart and chest pain coming from anxiety. And actually, it can be hard to tell. Sometimes they do feel similar. And so I'll tell you some signs of typical chest pain or angina coming from blockages in the arteries and pain that seems typical of inflammation of the heart. But people also have atypical chest pain, and that can feel like anxiety. So if you haven't been checked out by a doctor and you feel like you have concerning symptoms or any symptoms that you feel like you should ask about, then you should definitely see a doctor and get evaluated. But basically, typical chest pain that can be, a typical angina for chest pain from blockages in the arteries of the heart can occur in the center of the chest, and it gets worse with exertion or stress. And so, exertion could even be just getting up and walking across the room. And then it improves when you relax or you're resting, like you sit back down and you feel like it's better. But again, that's typical angina or chest pain, and a lot of people have atypical chest pain with blockages in the arteries. And so that's why if you feel like your symptoms are concerning enough to ask, then you should definitely see a doctor to get evaluated to find out if your symptoms are, atypical or if they're actually related to anxiety. And if they are related to anxiety, then you can know, you have to be mindful of like what your triggers are and what your symptoms are that go along with anxiety so that you can know for yourself that that's what those symptoms are. Now, symptoms that are more typical of inflammation of the heart include, chest pain that gets worse when you take deep breaths or when you lie backwards because the outer layers of the heart and the sac encasing the heart are rubbing against each other. And so the pain can get worse with deep breathing or leaning backwards and feel better when you're sitting up. And so that can be a sign of inflammation of the heart.